One of the most common types of autoimmune diseases is Hashimoto's thyroiditis or autoimmune thyroid disease. This is something that I treat a ton of, and most of us at WholeHealth Chicago treat a lot of as well. I had mentioned in a previous video, if you want to screen your thyroid, there are several very important tests that you need to look at, those being TSH or thyroid stimulating hormone, free T4, free T3. You have 2 thyroid antibodies, thyroid peroxidase antibody, an anti-thyroglobulin antibody, and something called reverse T3. So a patient with Hashimoto's may have issues with their thyroid looking a little bit sluggish or underactive, and they have high antibodies, so it's an autoimmune process against their thyroid. It's important to get on the right prescription medication if that's warranted, but also doing a lot of gut healing and immune support to really balance the physiology of what's happening there. And we're great at doing that in naturopathic medicine and at WholeHealth Chicago.
Awesome. So can you explain what are some of the common symptoms that would make you want to do those tests if you're wondering if this patient might have Hashimoto's?
Mm-hmm. Sure. Symptoms that would make me suspicious of Hashimoto's would be fatigue, hair loss, inability to lose weight, insomnia, constipation, so anything where somebody's feeling really sluggish. It's also common to just, I don't know how to say this, I guess, sorry, I'm making this choppy. Most thyroid conditions are Hashimoto's, it just may not have been diagnosed yet. So I've had plenty of patients where they've been diagnosed with hypothyroidism for the last 20 years, but they've never actually had their antibodies checked. And then we check the antibodies, they actually have Hashimoto's. So knowing that is really valuable, because then you know that you want to treat the body for autoimmune disease as well as having thyroid dysfunction.
Awesome.
So that's something, that's common too.
Okay. And can you talk about the difference between hypothyroid and hyperthyroid?
Sure. Core differences between hypo and hyperthyroid are, with hypothyroid, everything is just sluggish. So you're tired, you're worn down, hair loss, your skin is dry, you're constipated, so everything is just moving really slow. In hyperthyroid, everything is over-functioning and it's too much. So you might be anxious, sweaty, losing weight that you're not trying to lose weight, having heart palpitations. So while that's the textbook presentation, people aren't textbooks, it doesn't always perfectly present that way, but those are sort of the major ways to differentiate between hypo and hyperthyroid.